Welcome, everyone. I am pleased to introduce Dr. Larry Farmer, who is an associate professor here at the Graduate School of Social Service. He is also the director of the doctoral program. He is also our lead evaluator on this project, which you are all participating in, and many other things as well. Dr. Farmer, I believe you were the co-president of the Group for Advancing Doctoral Education. Mm-hmm. And Dr. Farmer also does an extensive amount of work related to implementing social emotional learning programs in school settings. And as many of you are well aware, schools are the next frontier for integrated behavioral health. And with that, Dr. Farmer, I will turn it over to you. I don't want to take up too much time away from what you're going to talk with us about this evening.
Okay.
So welcome.
Okay. Well, good evening, everyone. As Dr. Ross said, I'm one of the full-time faculty here and directing the doctoral program over the last couple of years. Has been something that I've been doing along with just being a full-time faculty person here. I'm going to share, I really struggled with what to talk about this evening. And I will be sharing some of my research, but I think more of what I want to share is some of the stuff that I've been sort of thinking about, coming out of this or still being a part of this pandemic, and thinking about my own work and its direction and what that may represent in terms of a larger kind of direction, I think, for social work. So I'm going to share a little bit of that this evening with you. Okay. So let me share my screen for a second. So first, let me just a thumbs up if you can see my little PowerPoint. Okay, good. I went through the other day, I was teaching and got through about a half an hour of teaching and realized that my students couldn't see the PowerPoint. So I always want to sort of check in with that. So I was struggling with a title for what I'm going to talk about tonight. And so I came up with this idea that this talk really reflects some review that I've been doing about my work and about its direction of my work. And I'll share with you one particular project that is just sort of getting started, which I think for me reflects a little bit more of an extension to the direction of my research. And a lot of this review on my part is been influenced by what I've been seeing and hearing and reading as it relates to our current pandemic. And there are a couple of questions that I've been sort of thinking about my work. And these are just sort of two of them. One is really stepping back for a second. I mean, as someone who's actually been a faculty person for over 20 years now, I've been here 17 years at Fordham, and I actually was at Rutgers University on the faculty there in the School of Social Work for about 7 years. So now we're talking about almost a quarter of a century of faculty work. And as I was sort of thinking about, what I want to do or accomplish in the next couple of years, I started to sort of think about what area of well-being of individuals and families do I really want to have an impact on, right? And I think that's something that we all should sort of think about as social workers, right? Because we're in this business primarily, because we care about individuals, we care about families, we care about children, we care about older adults, right? And I think one thing to sort of help to situate our work is to really think about, well, within the realm of my work, where do I want to have an impact on? And then the second thing I started to sort of think about was, recognizing that as a sole individual, my impact is fairly limited. No matter how, smart I am, no matter how energetic I am, my impact is limited as a sole individual. But my impact can be magnified by my efforts to partner with others. So I had to sort of think about, who do I want to partner with in the work that I want to do? So those are two things I've been sort of really, struggling with and thinking about over these last couple of months as it relates to my own work. And when I think about where I want to have the impact, where I want to have the most impact, I start to think about our profession and the ways in which different areas of our profession have begun to sort of think about, what are the places that we need to concentrate our work, right? And to have an impact on the well-being of families and individuals. And you could think about the United Nations and its identification of the sustainability goals as one way to sort of think about, what are some of the major areas that need to be addressed in order to improve the well-being of families. And specific to social work, there's this Academy of Social Work and Social Welfare, which have developed what they call these grand challenges, right? Both of these are efforts to kind of sort of identify important areas of work that social workers and others can be involved in that really can have important impacts on the well-being of families, of children, of individuals, right? So I started to sort of think about, where does my work sort of fit in, or where do I want my work to fit in terms of what people a lot smarter than me have put thinking into to try to organize, where are the places we need to sort of think about having an impact, right? And then the other thing, again, who do I want to partner with to have that impact, right? Who do I need to partner with to have that impact, right? So when I think about sustainability, I sort of said, well, the work that I've always been involved with in terms of youth, in terms of school-age youth, and their ability to be successful within school environments and beyond, I sort of thought about that my work has really can be centered in terms of promoting the well-being and health of individuals, in particular youth, and improving the quality of education that those youth have access to, right? That those are some two ways, if I was to sort of say, okay, where does my work situate itself within the United Nations Sustainability Development Goals? I would say it kind of fits into that. And then I sort of thought about, well, what about the grand challenges, right? If I were to situate my work within the grand challenges, where would I say my work sort of is situated? And I thought about that, well, within the context of promoting youth development, I can't ignore the role that racism plays, in particular systemic racism within our school systems and within our larger culture, how that impacts on that. So my work has to be responsive to that, right? And then I think that the other area, obviously, is that I'm concerned about the healthy development of youth, right? So that's sort of the first thing I thought was important for me to do over the course of the years, was to sort of rethink how my work is situated within these larger sort of goals that are related to promoting well-being of the youth that I have spent years studying in different ways. And then I sort of thought, okay, well, I need partners. And who are the partners that I've had historically? Who are the partners that I need to continue to cultivate to do this work? And at this time, I would say, yes, I've got colleagues, both here at GSS and at other universities, who I have partnered with in my work. Within the context of, New York City, I have developed a relationship with the Urban Assembly, which is a nonprofit organization within New York City that has as its mission really the promotion of quality education for public school students, and has this history of working to develop and support, public schools, and so that's been one of my partners. And that's where the work around social emotional learning has sort of come in, is in that partnership with the Urban Assembly. And obviously, along with that, I'm partnering with the Department of Education here, the DOE, New York City's DOE. That's also been my partner and will continue to be my partner in the work that I'm doing. So I think that it's important to think about in your own work, who are you going to be partnering with to accomplish what you want to accomplish as a professional social worker, right? And that you may have many partners and the partners may change over time, but recognizing that if you are going to be successful in your work, it is going to be in part because of those partnerships that you've developed and cultivated. All right, so now I'm kind of I want to move into, okay, well, what are some examples of those partnerships and the work that I'm doing right now, that I'm just getting involved in right now? And I have to sort of start with providing the context for some of that work. And the pandemic obviously has now become the context for all of our work, right? I mean, it's pretty hard for us to not acknowledge that the pandemic is the context for our work. And it will be the context for our work for years to come, because of the impact that it's having on the individuals, the families, the children that we're working with, right? So when it comes to thinking about the children that we're working with and the families that we're working with, there's lots of research coming out now to really speak to the issue of how the pandemic is impacting on children. And it's impacting on them, in every part of their being, right? Whether it be physical, emotional, right? It is having a devastating impact on all of the children and adolescents that you might be working with, and that I have been, concerned about in my own work, right? And we have to sort of acknowledge that impact has been differential. So it's impacted more heavily on some than others, right? And I like this little quote here from a newspaper article that was talking about, the impact of the pandemic, where it's an anonymous person. They didn't have who the author of that particular quote was. But again, it reflects the fact that we have to acknowledge that the impact the pandemic has had has not been the same for everyone, right? And it had to do with, like many things, how resourced you were going into the pandemic. Were you already sitting on a yacht when you came into the pandemic, or were you sitting on a rowboat, or were you still already sort of just treading water when this pandemic hit? And where you could think about our children. And then the other thing that I think is a part of my thinking now is that while this was a serious crisis, it's also a serious opportunity for us to reimagine the work that we're doing, right? To recognize that we need to take advantage of an opportunity that this pandemic has to allow us to rethink our work and to press others to rethink their work, right? Okay, so in the context of all of that, my work this year is beginning to center more and more on the New York City Department of Education, right? And just to, let you know or give you a sense of how important that I think that work is that the New York City DOE is the largest school district in the country, right? over 1 million kids are in that school district. I mean, just sort of think about that for a second. Over 1 million kids are in that district. It is one of the most diverse school districts in the country, right? They don't have the figure on there, but at one point I saw a figure that something like over 130 different languages are spoken in the homes of children in the DOE, right? You know, and you just look at these little statistics here to understand how diverse this district is and how important it is because of what it represents in terms of, you know, the number of children that are impacted by what is or is not happening in that particular school district. Okay. One of the things that, again, my work is beginning to be involved with is this effort on the part of the DOE to address what they anticipate are the social and emotional needs of kids now returning to school, right? After being remote, after in some cases being completely absent from any public education for a year. And this project is called Strong Resilience UNC. And it is grounded first in this effort to provide an assessment of the social emotional competencies of all 1 million plus DOE students, right? That's the goal of this project. And then to use that assessment as their basis for then the development and support of services that will address the social emotional needs of those students, right? And I have had the fortune, because I think in part of my work with the Urban Assembly, to be a part of the research team that is working to implement the assessment, to also gather data on the existing sort of interventions that are going on and the potential future interventions that need to go on to support these students, right? Along with this effort is the hiring of 500. So the DOE hired 500 social workers. And this is on top of the existing 1,300 social workers that are in the district already. So they now, as of today, in a conversation I had with one of the staff at the DOE, there are 1,800 social workers in the DOE. And the goal is in part to use this data that's being gathered on the social emotional competencies of these youth as a part of the basis for now supporting the work that those social workers will be doing in the district to support those students. That was my slide talking about the 500 social workers, 1,800 existing social workers. So again, that's a part of this NYC Resilient Strong project, right? Okay. And so the thing that in part we've been tasked with, this group has been tasked with, is not only sort of the management of this assessment and then the analysis, the reporting back, and the benchmarking. We're doing all of that sort of work. But the other piece of this is, how should social workers respond to those needs? How should social workers use that data to inform the work they're doing with students? Right? That's sort of the biggest issue that I think is a part of why I'm interested in the work that's going on with this project, is not only, what does it help us do to understand the needs of youth, but once we understand those needs, how are we to respond to those needs, right? Okay. Right. And the challenge for social work, in particular school social work, has always had a challenge in their work in school districts, in part because social work, in part because social workers in schools have always been seen as visitors, right? Right. That's not our setting. We didn't create that setting. We're not the primary focus of that setting. The focus of that setting is education. It's not social work, right? It's not mental health, right? And so we've always been sort of seen as visitors. In many districts, and in particular the DOE up until recently, social workers have, for the most part, been relegated to the work with IEPs, individual education plans, and special needs students. That there's sort of been, that's been the emphasis of the work of social workers and where they've sort of been relegated to. And they've also been seen to have a limited role in sort of counseling of students who had mental health problems. So that's sort of been what we've been relegated to in many instances. And I think that's a challenge for us to be successful in those systems and really meeting the needs, not only of a few students, right? Because in fact, what the data shows is that very few students who need serious mental health counseling in our schools. Maybe something less than 10% actually need that sort of intensive mental health counseling. But the vast majority of students need other kinds of sort of emotional supports that we as social workers can do, right? I think the other challenge has been for us is developing a practice model that is responsive to practice within a school setting, right? That's sort of been the other one. We spent a lot of time developing practice models that are more clinically oriented, right? And we haven't spent as much time really thinking through what is an appropriate practice model for a school setting. And there's been some efforts on this part. There's a National Association of School Social Workers who over the years has come up, this is an example of one of their efforts to develop a practice model. And there are some more recent efforts to develop a practice model. But those practice models still tend to have a little bit more of an emphasis on what we call tier 1 interventions. That are more intensive and more clinically focused than I think what is needed within our school settings. Okay. Let me go back up a sec. The other challenge has been that we, as a discipline, when we're in school settings, often don't know how to talk to teachers, right? We know how to talk social work and social work jargon, right? But we don't know how to talk education jargon, right? So we often have a very difficult time translating our work into a way that teachers understand our work beyond just sort of a stereotypical clinical kind of understanding of our work, right? And that, well, you're here for the kid who's got some sort of psychiatric diagnosis, and you're going to provide therapy and treatment to that, right? So that's been a challenge, is to develop within social workers an ability to translate their work into education speak, right? Okay. And to have a common language to discuss students' behavior that is one that transcends a clinical orientation. Right? And so one of the things that I've been doing with the UA, and the thing that has attracted me to my work with the UA, is to use social emotional learning as a framework to translate the work that we do as social workers into a language that teachers understand, and that is responsive to the way teachers think about the work they're doing, right? and that also directly aligns our work with the outcomes that teachers care about, which is they care about students' grades, students' attendance. These are things they care about, right? And our ability to translate our work into how the work that I'm doing is directly going to contribute to what you need in terms of student outcomes, right? And so social emotional learning is a nice framework. The concepts and the framework itself are a valuable framework for that translation, for us to translate the behaviors that we see in students into a language, number one, that is strength-based. That's the other challenge or the other issue, is that our clinical language tends not to be strength-based, right? When we talk about diagnosis, a child has conduct disorder, attention deficit disorder, these are all deficit-based models, right? Okay. SEL allows you to sort of talk about students' behavior in a strength-based approach. It allows you to specifically be able to align that behavior to student outcomes, right? And because it is a framework that teachers are growing in their school systems and teachers are growing in their utilization, right? It is a framework that they are now familiar with, right? We don't have to educate them in our jargon, right? Okay. It also has grown to be a framework that also moves the center of our work away from just the student to now thinking about the teacher and the teacher's behavior, the school and its school's supports and behavior. So it allows us to actually utilize the fact that we are not just micro-oriented, that we understand about systems. And we understand about the way in which systems impact on individuals and how the importance of addressing system change if we want to see any important outcomes or changes at the individual level, right? So the whole movement of SEL has also moved to what they call transformative SEL, where the transformative is now that we have to move our focus away from solely focusing on children to now focusing on the adults and the adult systems that surround those children, and to think about how those systems can support the development of these competencies, right? It also talks a lot about how our approach to learning needs to change and provide more attention to issues of culture, issues of social justice, right? And issues of, or mechanisms that allow the empowerment of students to be much more active participants in learning, right? Okay, which again, these are all values that are consistent with social work, right? Right? When we talk about self-determination, right? These are values that are consistent with self-determination. We talk about being concerned about equity. These are concerns that are within this sort of movement towards what's called transformative social emotional learning, right? So this is something that I have been increasingly involved with, and the entry point this year with DOE has been with the Strong Resilient project. The other thing that SEL has allowed me to do is to also, again, move away from just thinking about the work that social workers in schools do with students, to now think about the way in which social workers can work with the larger administration of a school to help support their effective implementation of programs and policies that are going to support students' development, right? And so a lot of the work that I've been doing with the Urban Assembly with the interns, so over the years, we started out with like 3 interns, social work, GSS interns who worked in some of the Urban Assembly schools around this Resilient Scholars Project, where they were helping to support the schools and actually implementing social emotional learning interventions in the schools. And now we have moved up to like 14. I think this year we've got around 14. We had 14 interns last year. I think we've got 14 this year in Urban Assembly schools. And again, what that has allowed us to do is to focus the attention of social work in schools, or expand the role that social workers played in schools, so that they're not just sort of seen as, well, you're the person who works with the individual students, right? And you pull them out and you do counseling, you do small group work. That's what you do. You do the psychosocial assessments for your IEPs. That's what you do. Now the interns that we've had working in schools are now actually working with the administration. They're working with the principals and with the VPs at the school and with the other instructional leads to actually support them in implementing programs school-wide, right? Changing the way in which schools are approaching, for example, the support and management of students' behavior, right? Okay. And using, research and theory around implementation science, right? And educating those administrators, those teachers, those instructional leads on, what does the science tell us about how to effectively implement a program, and supporting schools in doing that, right? So that sort of is, in a nutshell, kind of where my work has been at. And it's, and so the 2 major projects that I'm involved in is, as I described to you earlier, the Strong Resilient NYC project. And just as today, a new project with the DOE where I'm going to be working to survey all of the 1,800 social workers in the DOE to look at their training needs around social emotional programming in the schools, and the kind of supports they may need to actually use that DESA data that's going to be gathered on their students to then support the work that they're doing. So that's, 2 of the projects that are probably going to consume, some of my time this year, that relate to some of the things that I care about. Okay. So that's a lot that I sort of quickly have kind of walked through with you. And I'm open to any discussion now or questions about anything that I've sort of shared with you.
Yeah, I really like the point that you made about how social workers are often viewed in school settings. Like it's almost as seen as just like 2 different, disciplines trying to interact, and especially looking at integrated health, how we see that very often, how we just kind of silo social work and social workers and what they do into their own. Like, that's what y'all do, and this is what school is. Let's keep it that way. So I like that you spoke to that, because I do think, that speaks to a problem we still see, and just how, you could say that how the role of teachers, the role that they play in when social workers try to be involved with children, and how, there's baggage attached to like every participant is what I'm trying to say, which I thought that I liked that you spoke to. And just a question that I had, I guess, in that point is that as you entered this field and you began your work, how did you, handle that very difficult process of like becoming aware of how you stood with the teachers in the schools that you entered as a social worker?
Well, I mean, it's interesting because I was a school social worker for a number of years. Actually, my first job post MSW was as a school social worker, right? And what I recognized very quickly, now part of it is that I had done as an undergraduate, and even as I was doing my MSW, I was working in schools, right? I was a research assistant in a school district, research and evaluation office, where I often worked in schools, working with teachers to implement research projects. So I had that experience before I became a school social worker. And what I recognized, about teachers is that you have to, when you enter schools, you have to be a teacher. You have to present yourself as a teacher, right? And you have to, my favorite thing to do when I was a school social worker is I would hang out with teachers in the teacher's lounge, right? Okay, not in my office where I saw some of my colleagues. They spent most of the time in their office. They went and got their student, brought them to their office. They worked in their office, and the teachers, I hung out with teachers, right? Because I had been involved in educational settings before becoming a school social worker, I knew the lingo, right? I knew the teacher lingo. I knew the teacher culture, right? Which is very different. Middle schools versus elementary versus high schools, very different culture, right? Okay, because high schools, they're all specialists, right? They teach one subject, maybe two, but in most cases, they're certified in one subject and they're specialists in that subject. And they all hang out together. The math folks hang out together, the English folks hang out together. Elementary school, you're a generalist. You got to teach everything, right? Okay. The only thing that distinguishes you is, are you teaching the first, second, and third graders, or the fourth, fifth, and sixth graders, right? Okay. So I understood that culture. I understood the differences at the different grade levels and what that meant in terms of how people interacted with each other, right? And I hung out in the classrooms. So even when I didn't have a student in a classroom, I might sit in on that classroom, right? Okay. I might sit in on the classroom. I would often try to sit in on a classroom with a teacher who I knew was a really good teacher, right? And a really good ability to manage a classroom. So I could see what that teacher was doing. So when I went to the other teacher who wasn't that good, I could say, Mrs. Jones, this is what she does, right? Okay, because they don't want to hear what I do as the social worker. They want to hear, what do their colleagues do who they know are good colleagues, and that you've paid attention to. And I say, I paid attention to what Mrs. Jones does, and she handles this a little bit differently, right? And it seems to kind of work for her. What do you think about, trying that out, right? So one of the things that I recognize is that I had to be a teacher if I'm in a school, right? I could be a teacher who has a social work degree, who's also a social worker, but I just can't be a social worker, right? Because teachers are very territorial of their discipline, as we are of our discipline. They're very territorial of their discipline. They're very territorial of their room, right? You got to know, when a teacher closes that door, that's their little kingdom, right? Okay. And so you can't walk in there making a whole bunch of suggestions right off the bat about what to do and what to change. Right. I guarantee you, if you won't get a good reaction because that's their little kingdom. Right. Okay. And they're very territorial, that little kingdom that they have there. Right. So part of, what I think helped me was that I understood all of that before I became a school social worker, because I'd hung out with teachers, right? And in particular, I hung out with them, asked them to do things that they normally don't want to do, which is they don't want to participate in research, right? So I figured out, how do you get teachers to fill out surveys, right? And collect data for these research projects that they don't care anything about, right?
How do you do that? What's the key? How do you bribe them?
Oh, no. The key is you have to be one of them.
Be
right?
Human.
You gotta be one of them. Yeah. You can't be the outside researcher. You gotta be one of them, right? You gotta be a colleague. They'll do a lot for their colleagues, just like we do a lot for our colleagues, right? That's human behavior, right? And you also have to be able to translate your work into something that's meaningful to them, right? How is this data that we're going to get you to collect, for example, with the DESA, we've spent a lot of time with the Urban Assembly, spent a lot of time translating DESA data into actionable teacher behavior, helping teachers see, how does this data actually help you figure out what to do in your classroom, right? To get your students to be attentive, to be persistent, right? Okay. We had to spend a lot of time with that education piece, right? And providing mechanisms to help them translate that data into to actionable stuff on their part, right? Okay, so it's got to be relevant to them. Okay. Other comments or questions? The other thing one thing I want to emphasize is that we also have to, we are so underutilized in schools, and I think it's our fault, right? Okay, because we don't make people aware of what it is that we're capable of, and that we're capable of more than just sitting down and counseling individual students, that we're capable of analyzing systems. We're capable of thinking about how systems can be changed and altered to change the context in which the behaviors that we're seeing are occurring, right? We spend a whole bunch of time learning about that kind of stuff, right? And we often don't communicate that well, that these are some of the competencies and skills I have that go beyond just my ability to work with individual students and individual families, right? And the reality is that unless we do that kind of work, the kind of outcomes that we're going to see are not going to be as much as what we could see, right? I used to always, when I've, got my feet, settled as a school social worker, I would always tell my administrator and my teachers that the work that I do in a half an hour is not going to undo the work you've done with a student for 5 hours, right? So if that student is in a classroom with a teacher who is not able to be responsive in a positive way to supporting that student's behavior, I'm not going to fix that with 45 minutes of work with that student, right? Okay. So my work is going to be more effective if I can get that teacher to behave differently than if I have a student who has a teacher who's not behaving in an appropriate way, and I pull them out for 45 minutes and give them some sort of counseling or put them in a small group twice a week, right? And I think we need to also as best we can, communicate that if we don't work to change the systems around the students, then the work that we're doing, it's an uphill battle, right? Because they spend much more time in the classroom than they're going to spend with me, right? And that teacher is much more impactful on them than I'm going to be on them, quite frankly, no matter how good my clinical skills are.
I have a question about, you mentioned kind of shifting the focus with SEL from just children to also including adults and adult systems. What do you mean by the adult systems? Like, what does that look like?
Okay, well, the adult system really focuses on the way in which the school itself, the policies, the procedures that are implemented in relationship to students' behavior, the way in which those systems either ideally reinforce the development of the competencies that we know are needed for students to be successful. We know that students need to be able to manage their behavior, that all of us need to be able to manage our behavior, that all of us need to be able to be self-aware, to be socially aware, right? To be goal-directed. These are all things that we know are important for us to be successful in any context, but specifically within a school context. And we know that the school can set in place policies and procedures that will support those competencies, that will reinforce those competencies, that will provide instruction, opportunities for students to be instructed on those competencies, right? And that has sort of been the work of SEL, where SEL is moving towards is not, okay, we're going to provide some direct instruction, so we're going to teach students about self-management, but that's not enough. We have to teach teachers about self-management. They have to demonstrate their own self-management, right? And we have to have larger policies and procedures that also reinforce and provide opportunities for students to practice self-management, right? If we actually are going to get that competency developed within students. So that's what I sort of mean with that.
God, thank you. I'm glad I asked because I was thinking you're like talking about, whatever. That makes a lot of sense. Thank you for explaining that.
Okay. I'd say Ricardo had his hand. I think I saw Ricardo has his hand raised. I saw a little note. I can't see everybody.
Yes. Are you ready?
I'm ready.
Hey, thanks so much for your presentation, Dr. Farmer. Gosh, I have a list of questions here. And I think maybe a two-part question, truly a two-part question in the same scope. I think the kind of social work that you're talking about is really compelling to me. The idea of working with students, as it's already been happening, but with an eye toward, or maybe two eyes toward, changing the system of the school. I could see that really impacting a lot of communities in deep ways. So I guess maybe this one's an easier one to answer. What's a resource that you'd recommend for us who might be interested in school social work and the kind of school social work that you're talking about? Is there a resource or resources, or are there resources that we can look into for further learning?
Well, I think there's two resources I would suggest you take a look at. One is an organization called CASEL, and CASEL.org. And CASEL is an organization that over the last 20 years has been spearheading the implementation of social emotional learning in school systems. And they've been doing research, they've been doing training, they've been doing advocacy, and they are a place where a lot of the work around social emotional learning has sort of found a home in terms of the research, the training, has sort of found a home. So I would say CASEL is a good place to learn about, this approach and how it relates to social work. The other one is there's the National Organization of School Social Workers, right? And they've got a website. I forget what their website happens to be, but you can Google National Association of School Social Workers. And they have resources on their website around the different models of school social work. And Andy Fry is a researcher in particular who's done a lot of work in this area. He's at St. Louis in their School of Social Work. But you can go to the National Association of School Social Work and you can find, a lot of the work that's going on here in this area. And they have a conference every year. I forget where it's going to be at this year, but they tend to be in the South for some reason. Either the South or the Midwest is where the conference tends to sort of be at. But
it's not cold. It's not cold there. That's why.
Well, yeah, that probably is because some of the folks it probably is why they tend to. There's some reason they like what's that city they always like to go to? I'm blanking on it now because I haven't been to the conference. I didn't go to the conference in a couple of years, but yeah, those are two resources. Yvette, you got your hand up?
Yes, thank you, Dr. Farmer. I just want to jump in because I know there are many, many, many students here, pipeline fellows who are in schools. I have been doing site visits over the last 2 weeks and been to these schools. You should be nodding your head because I've been to your schools virtually, albeit, but you're doing exactly what Dr. Farmer is talking about, or at least learning how to do exactly what Dr. Farmer is talking about, engaging with administrations, engaging with teachers, being an integral part of the social work department. Shanice, you're holding it down there. You know it. Why didn't I hear from you? Dr. Farmer should hear. Yes, Dr. Farmer, tell me more about that because I had this situation this week or last week. Angie, you are running that department over there. You know it. And I'm just looking around to see who I see, but you know who you are. So let's own what we are doing because you're doing it. And Dr. Farmer is can be a fantastic mentor, role model to say, hey, is this best practice or can you tell me and teach me? Because you're doing it. And if you're not in a school, this still applies because it's all integrated. And that's what this pipeline is all about. How do we work collaboratively to make it happen for our clients, our communities? So thank you, Dr. Farmer. And I just wanted to say you're preaching to the choir because we're on your team and you got partners in this pipeline group. So thank you.
Glad to hear that.
And I want to hear from the choir as well, but I would also jump in and say, just to follow up on what Dr. Seeley was just saying. Now, I have not been a school social worker. I've been kind of strictly in the more traditional health systems. But what you're talking about with these social emotional learning, really systems level interventions, this is prevention. This is it. I mean, this is a prime example. And you're also talking about something that we talk about in public health quite a bit, that we are going to begin to talk about in integrated behavioral health towards the end of the semester, things that you'll hear about in healthcare policy and advocacy. These population health approaches to intervention, which means the population of students in a school, as opposed to these one-off, more tertiary level kind of individualized interventions after a problem has already happened, somebody goes to treatment. And I really appreciate this. And I also see so many incredible parallels around the interprofessional communication conundrum. Social work seems to in multiple systems and settings. I would imagine it's not just health, it's not just education. We might find ourselves, with these communication challenges in other systems as well. I'm really glad that you're here talking about something that is just so quintessential preventive in nature. So thank you for that. And now the choir, I would like to hear from all of you who are in. Well, I mean, that's Dr. Seeley said we're preaching to the choir, and the choir is here, and there are many people who are practicing in schools. I see
Lady Olivine, you know who you are. I'm switching screens to see you. But again, if it's not a school, it still relates. It's still relevant because you're still doing it. But I'm just talking to and calling out and giving props to my school people right now. You know who you are, and you're doing it.
I actually did want to jump in and ask a question. I had this question for a while when I heard Dr. Farmer was coming to speak. Well, thank you for coming to speak to us. And I'm very lucky to be a part of Urban Assembly this year. It's my placement. And so it's been a very fulfilling placement for me so far. But outside of Urban Assembly, I am a program coordinator for an after-school program, and I've been doing that for almost 10 years now. And something that I've noticed is from doing this work in the after-school program, we're located in a school, and so we partner with UICD. And what I've noticed is during the school day, SEL was never really a thing. A lot of teachers were not informed on it, and so were principals and other school administrators. And so, we would be going in as a social service agency with this group work model in our after school program, doing the SEL work for a long time and sort of being looked down upon for going in and doing these engaging activities that are very different from the academic structured type of day that kids usually are used to. And now that, this new strong NYC initiative is happening, which I've been hearing about throughout the schools, and I hear the teachers talking about it and asking about the DESA and just like feeling lost because they're like, what is all of this and what's going on? My question is how can community-based organizations get a seat at this table, and like what can we do to assist these schools, especially since we've been doing the work for such a long time and are educated in it? And I feel like we can increase that number of the social workers that we have in New York City right now with all the school-based organizations combined.
That's a good question. I think that's a good question. How can you get a seat at with regard to some of this? I think that one of the ways to get a seat at the table is that in the city, they are beginning to try to organize. In fact, the Urban Assembly has sort of spearheaded over the last year or two an effort to organize agencies in the community that are doing SEL work, right? We actually, before the pandemic, the plan was that we were going to actually do kind of a citywide assessment where we would basically survey various community agencies to then sort of document where is the SEL work actually happening across the city, with the idea of, how do we come together to coordinate some of that work, to share, what we're doing, right? Because, there's a lot of ways in which SEL work can be done that is being done. And so we wanted to understand the different ways it's being done. Now the pandemic kind of, stopped some of that work, right? But I think that if you, email me, I can put you in contact with the folks at the Urban Assembly who have been trying to, again, bring together that group of community-based agencies that is doing SEL work, right? We actually have, over the years, we've actually had a conference each year. There's been a small little conference that we've had, primarily to showcase the work of some of the Urban Assembly schools around SEL. But that conference has in the past also invited other community groups to submit proposals, to do presentations of their work around SEL, right? Again, the idea here is that we want to showcase and understand what people are doing to help develop these, potential different, partnerships around SEL across the city. And so email me and I'll put you in contact with, Dave Adams, who's now the CEO of Urban Assembly, his assistant, who is in part is involved in coordinating, the work, trying to identify the different agencies that are doing work and then coordinating opportunities for us to sort of come together to talk about the work that we're doing.
Thank you.
All right. The other thing I'll sort of say is that I think that right now the DEO is trying to figure out how to support schools in this SEL work that they've now committed to, right? And I think that's another opportunity. Remember that the way our schools work in the DOE is that if you want to get or have contact in terms of your work with schools, if you want to increase that contact, the first thing you have to sort of get on board is the principal, right? So having that conversation with the principal about the work that you're doing and how that work may support the work that that principal is being tasked to do now by the DOE, I think is really your first step in getting that in entree. Because everything, the principal is, the leader of that school, right? That person has a lot in the New York City Department of Education. That person has a lot of control over what happens in their school, right? And so that's the first point of contact is you get that person on board. That's the person you need to sort of, get on board if you want to have an entree into, expanding your work in the schools around SEL. And they're hungry for that at this point because they've been tasked to do that. But as it works in many systems, they've been tasked to do it, but they've not necessarily been given the resources to do it. But you are now a resource that they'd love to tap into to help them do what they need to do.
You just touched on a question that I had around just that, I think resources. As you know from your work, that it is no small task to implement something new, sometimes something that may be viewed as a complete 180 or, on a culture shift. I think especially in the, in the midst of a pandemic, I'm not going to call it post-pandemic because we are far from that. It's going to be a very tall order. My question is 500 more social workers going to be adequate in terms of what we think is coming down, or what we know actually, and what your data will actually support. It'll be data that goes with things that we already know, right? Was coming down to the pipe for these for kids. I mean, I saw a report came out 2020, something around 50% of New York City kids are either entering poverty for the first time or re-entering. And we know that that is likely the most salient social determinant of health, arguably second maybe to racism, around outcomes. And it seems like 500 is a little bit light on the number of social workers who might be warranted. And I want to get your opinion on this, or is this kind of the first step forward in a longer walk, marathon, whatever the metaphor may be?
Yeah, I mean, clearly 500 is not enough, but I think you have to sort of think about how can we best use. I mean, right now there are 1,800 social workers in the DOE, right? So yes, this additional 500, but there was already 1,300 already in the DOE, right? And part of, I think, the problem number one, of course, we could always use more social workers, right? In the DOE, we got over 1 million kids in the system, right? And so we could always use more social workers, right? But I think that the other thing to really sort of recognize is that we have to reimagine the work of social workers, right? Up until this point, the vast majority of the work of social workers was dedicated to work with special needs students, doing IEPs, doing reevaluations of IEPs, right? That was where most of their work was relegated. And then you had, within the DOE, you had 3 pockets of social workers that were part of what they call crisis teams, right? So there was a north, a south, there's a north, a south, or east, I think, or something like that. There's only 3 of them. They didn't have all 4. But there were these sort of 3 pockets of social workers, about, I think there were around 25 in each of those pockets, that were part of a crisis response team, right? So if something happened in a particular school, they would deploy these social workers to the school. And their only role was really around this crisis response, right? So part of it, I think, is that we have to help the district reimagine how you utilize social workers. They're not going to ever get to the point where, they're going to double the number of social workers beyond what they have now. That's not going to happen, right? Okay. But what can happen is that we reimagine how we use those 1,800, right? And we reimagine them in terms of not just their work with individual students, but their work with schools, right? And their work on creating systems of supports so that there's an ongoing support for students' development. How do we utilize those students, social workers in that way? So I think that that's what's really going to be needed, right? If we're going to have, a meaningful effect with the numbers that we have, right now. Yes.
Okay. So I am honestly in complete shock because social emotional learning is such a big deal at my employment. It's something that we take like all summer to come up with a full year schedule of workshops and different things, PDs for teachers. And it's something that we really push out. It's something that we really focus on. Social emotional learning is a big deal for us at my employment. So it's shocking to hear that it's like going to be something new in the DOE, because it's something that we've been doing for about 3 years now, and we take very seriously. And it's different working for a charter school and working for the DOE, because one thing I realize is that I have more of an open door with administration. So I'm actually wrote a paper for my behavioral class with Professor Seeley, and I'm taking it, I'm trying to make a whole new intake process for the school. And it's something that I was able to go into the principal's office and say, hey, I think this will work better as far as applications and how we deal with bilingual students and how we deal with social emotional and just everything in this intake process, just changing the whole system. So I think it depends in the environment you work. Some people have more of an open door policy. Sometimes, they have like, they'll work with you, but not really, and they'll hear you out, but it might not be implemented. So I am grateful to hear that this is something that's coming in, because it is new. And there's something that you said that resonated with me, which I've seen work, is we have to have the teachers' support. Because once you have those PDs going and those trainings, and they kind of have the same knowledge that we have as social workers to a certain extent, it works wonders when working with students.
Yeah. Well, let me sort of say that it isn't the case that SEL is brand new to the DOE. It's been around the DOE. It's just not been widely around, right? So some of the work that I've been doing with the Urban Assembly dates back now. I mean, Dave was mentioning the day when I was meeting with him. It dates back almost 10 years, right? It took a strong hold in the DOE, actually in their District 75, which is their special needs district. You know, sort of a virtual district of schools that really, cater to the students who have, who have special needs, who have IEPs. And so it took hold there, right? Well over a decade ago. So a lot of those schools have been into SEL long before it became popular, even nationally. And then there are other schools that, the Urban Assembly has 23 schools, in the DOE. And those schools have all been sort of utilizing SEL for well over a decade now at different levels of implementation. So some have been whole school, like for example, there's a school called Unison High School, which they've been whole school implementing SEL for probably well over 7 or 8 years. And then other schools have just only been doing, parts and pieces of it, right? So I don't want to give the impression that SEL is completely brand new to the DOE. I do want to say that the mandate from the top that we're all going to be doing this, that's brand new, right, to the DOE. And this massive effort to assess social emotional learning of all DOE students, that's completely brand new to the DOE. But there are pockets of schools that in the DOE that have been doing SEL work for well over a decade. Other comments, questions, thoughts?
I think I did see, oh, yes, Olivine, is that your hand?
Mm-hmm. I liked when you mentioned that we all need to know the teacher's jargon and have a relationship. My internship is in an independent school, and I'm developing the SEL curriculum for the 4th grade to be dispersed throughout the school. And right now we're doing a diversity and inclusivity initiative. So I wanted to know what pointers would you have and what would you use as measures for this? So.
And may I just say, Dr. Farmer, Olivine's independent private school is different than your urban assemblies and a lot of your DOE schools. So Olivine didn't share that
yes,
her school is abundant with resources. Mm-hmm. And that matters. That's a good thing. We don't take it away from those students in that school. But it is a difference that we as practitioners need to acknowledge that it doesn't always, like you said, all those boats, there's a different boat from where Olivine is sitting to where some others are sitting. And I just wanted to put some context to it as well.
Okay. Well, I mean, one pointer I'll have to you, we've had the experience of developing curriculum for teachers. And it can be a shaky experience, right? Teachers welcome the opportunity to not have to develop curriculum. They welcome not having to put that time into it. But then they also often want to still have a lot of input into that development process, right? Okay, they don't like to be handed curriculum, right? Completely. So I would encourage you when you're developing curriculum for teachers to actually engage teachers in that process at some level, right? Because otherwise they'll see it as, you're handing me this curriculum, and they tend to not always be responsive to that approach. Even when, in the case, your curriculum is completely evidence-based, right? We've had challenges in getting teachers to actually adopt some curriculums around SEL because they didn't have a hand in it. You know, even though we could say this is evidence-based and it worked well in all these many schools, you know, they still felt a little territorial about just being handed curriculum. And that may be more the case because we're working in middle and senior high schools where there's a different culture around curriculum development than you might see in elementary schools. The other question you had was in terms of measuring outcomes. Okay. Well, again, I've been, you know, involved in the use of the DESA. It's a Devereaux Strength Assessment, student strength assessment. And the DESA is a good instrument for measuring social emotional learning of students. It is an instrument where they've spent a lot of time, which I think is very valuable, in developing materials to help teachers interpret and actually plan curriculum around what they're seeing in terms of social emotional learning. It also allows teachers to not only be able to assess individual students, but to also have sort of a profile of their class, right? And that has been really useful in helping teachers think about not just how do I support the individual student, but how do I support my class, right? In their development of social emotional learning. The downside to the DESA is that if you use the more comprehensive DESA, it's a long instrument, right? It's 40 items at this point, okay? And so that sometimes turns teachers off. They have to do, when you think about, I've got a classroom, I don't know how big your classrooms are. How big are your classrooms?
My classrooms are pretty small.
What's pretty small?
Just smaller than 20 students.
Okay, so even
independent private school.
Yeah, so even when you're talking about 15 students, right? Some teachers might find, and what level is your independent school?
I'm working in an elementary school. It goes to K to 4.
Okay, all right. So it's a little bit less demanding then, because maybe you're talking about one teacher having to assess maybe 20 kids. So that's a little bit more manageable for teachers. But there is a short form of the DESA that will often be recommended to you if you're concerned about that. The only thing about the short form, and it's real short, it's like 10 items, on that short form, is that you don't get as much of a comprehensive assessment of each of the sort of domains of social emotional competency with the DESA. It's much more, has been much more used, I think, as a screening tool than as sort of a tool that you can actually use for planning of interventions and supporting teachers, right? So the DESA is, again, a widely used and a popular one, and it is the one that the DOE is going to be using. So you also have the fact that if your children are transitioning from a DOE school to your school or going to a DOE school, there's going to be a common metric that's being used to look at their social emotional development. There are others out there, but the DESA has really sort of been the one that's gathered a large stake in the student assessment of social emotional learning. The other thing I like about the DESA, and we're actually working on this also with creating an assessment for social workers, but the DESA has an adult assessment of SEL. And so as you're looking at student SEL, it's also important to look at teachers' SEL, right? And to then maybe target some of your PD for teachers beyond just their understanding of how to implement the curriculum for students, but how they can also develop their own SEL competencies so that they are effective modelers, because the key to supporting students at social emotional development is not just the instructional piece, but it's on the modeling piece, right? Teachers need to model those competencies, right? And they need to be self-reflective of the extent to which they're actually modeling those competencies. And that's where the teacher assessment comes in. And then you can have PDs. In fact, one of my doctoral students, that's what she does. She's working at the Urban Assembly, and she does PDs for teachers on their SEL, right? She does an assessment of the adult SEL, and then she works with the teachers in doing professional developments around how do they develop their own SEL competencies.
Thank you so much.
Sure. A lot of good questions, especially this late in the evening.
I got another question, but I don't want to double dip. I saw something in the chat.
Who is that? Okay. I'm not looking at the chat, so sorry. I'm wondering, how do parents fit into SEL? Good question. Parents fit into SEL, I think, in two ways, and we have to do more work on this. There's some things we have to do more work on with SEL. But one of the ways that parents fit into SEL, and the DOE hasn't started, they were talking about doing this, but they haven't done it. But I've seen other districts do this. I'm in New Jersey, for example, and New Jersey districts are doing this, which is they're actually on the report card, not only are students' grades there, but their SEL assessment information is on the report cards, right? And material is being sent home to parents about, what these competencies are and how you can support the development of these competencies in the home, right? Okay. So how do you support self-management, social awareness, in the home, right? So that's been one of, the ways in which parents have been pulled into the SEL work, is to provide that data to parents and to then provide information to parents about how do you become a partner in developing your child's social emotional competencies. They're also one of the curriculums that we were using with the Resilience Scholars Project in SEL. One of the curriculums that we're using actually has certain activities in some of the modules that involves students actually engaging with their parents around these competencies. One of the ones that the kids love, they really love, there's a lesson that talks about self and social awareness, that talks about the way in which, the use of your cell phone and always being on your cell phone makes you less socially aware, right? Impacts negatively on your social awareness because you're no longer attending to people that in your environment, you're so busy looking at your phone. So it asks the kids to actually go home and monitor how often your parents are on this cell phone. And the kids love that. They love to do that and then come back and say, oh, my mom was on the cell phone for X amount of time. And I told her about how, this means she wasn't really paying attention to the people around her. She wasn't being, socially aware, right? So they really love that particular activity. So there were a few activities in this program. It was called School Connect, that curriculum that we're using. That also had activities that, again, reached beyond the classroom, engaged parents, had students engage parents in what they were learning around social emotional learning. Now, the curriculum is not perfect, and there were some things that teachers hated about the curriculum, partly because we gave it to them, and it wasn't theirs, but also because some of the examples in the curriculum teachers felt weren't responsive to an urban school environment. But I think there were some good things about the curriculum.
Do we have time for one more, Dr. Rossberg?
Be quick. Last one, and then we will end.
The wrong guy. Maybe I'll ask it, and maybe Dr. Farmer, you can follow up offline or something. But just thinking about the 500 new hires, and just curious, what's the prior experience? Are these brand new social workers? Are these slightly more experienced? Does it matter? I mean, I think it matters, but is that part of the hiring? And I guess all of that thinking, what's being done to support them, to provide good supervision for them in their own MSW careers, to incentivize them to stay, et cetera. And I'm asking selfishly because I'm thinking about the future. So,
well, this first 500, they were looking for social workers who were licensed. So that means that they would have had some, sort of post MSW experience in order to get their licenses. So they were looking to hire, my understanding, they were looking to hire mostly licensed social workers. I don't know what percentage of that 500 ended up being licensed. My guess is that probably not I don't know. I don't know at this point what percentage were licensed, but that was their goal, was to hire licensed social workers. In terms of the supports, at this point, they don't have a good plan in place to support them. Like I might have mentioned earlier, I actually met with one of 3 individuals in the district who's going to be tasked with supporting those new social workers in terms of onboarding them and providing PDs and training for them. So right now, there are 3 individuals in the DOE that, as of 2 days ago, have been told, you got the 500, do something with them, right? Okay, but that's the way systems work, right? And so part of the work I'm doing with one of those supervisors is that, okay, we need to actually do a survey and know who these, not only the 500, but the other 1,300 that are already there, right? We need to know a little bit about what they know, what they're doing, and what sort of professional development supports they may need. So that's the task that we are sort of undertaking over the next couple of weeks, is to put together that survey and to gather that data to then, figure out, okay, what kind of supports do we need to put in place?
That is an excellent question. Something we should be thinking about. Questions you might ask as you go out on the job. What supports are available to me in my next role? I see, well, it is 7 o'clock. I see Emily. How quick can we be?
I was just a quick question. I was just going to ask, would you consider expanding these efforts and collaborating with charter schools to implement this in charter schools or local universities?
Well, historically, the Urban Assembly, which is sort of my main partner around this, has not worked with charter schools, but that changed over the last 2 years. So we actually have been working with charter schools. Both in the city, we're working with a few charter schools, some of the KIPP schools. We've got some of the KIPP schools working with us around this issue. And outside of New York City, we're actually working with schools in Virginia. We're actually working with a school that is primarily an independent school that focuses on kids who actually are incarcerated, juveniles, in Virginia, and in Connecticut. We're working with some schools that are sort of outside of the public school system. So yeah, we all work. The Urban Assembly we're doing some work now with non-public schools.
Thank you.
Lots of growth, very important work. Dr. Farmer, thank you so much for joining us and telling us about these many projects that really do embody what I think is quintessential prevention. It's really important work, arguably now more than ever, given where we find ourselves. Really appreciate you being here, everybody. Remember what Dr. Farmer said about the data and why it's important. Here's my attempt to explain it to you. Grab that survey. I'm going to send it out on email as well. This is important because this helps us decide how to proceed with speaker series and these types of things. So it does matter for your experience and it matters for future cohorts. Again, thank you. And Dr. Farmer is a core member of the Pipeline for Youth Health team. And I'm sure if you do have follow-up questions, he'd be pleased to speak with you or to respond. I know he will also be very pleased to speak with you about doctoral work should you be considering it at any point, but perhaps that's a conversation for a later date. Thank you again.
Anytime.
And we will see you all soon.
Okay. Have a good night, everybody.